Cases of COVID-19 are rising among all age groups in Minnesota right now as health officials say there is an abundance of vaccine available. Hi, everyone, and thank you for joining us here at 5. I'm Kelsey Carlson.
And I'm Amy Hawker. The push to get Minnesotans vaccinated continues, and thousands of appointments are open. Fox 9's Rob Olson joins us. Rob, officials want everybody eligible now to sign up.
Yeah, they're really pushing that message hard, and the abundance of vaccine, the availability has become very clear. You know, on the last couple of weeks after I'd scheduled a vaccination with my own clinic, I got a couple of emails from the state saying I could come to the Mall of America clinic basically that same day. I've had calls from my pharmacy. The message today from health providers and the health department is that if you've been waiting until it's more available or more convenient to get a vaccination, you should stop waiting.
It's now your turn. We do have vaccine appointments available this week.
That message about COVID vaccine availability coming today from the Mayo Clinic. I was told the same thing from Allina Health.
We've got appointments available through the rest of this week and into next week, so you wouldn't be waiting more than a week.
In fact, Allina even posted to Facebook Wednesday looking for arms for 1,200 doses by Saturday. Many of those slots have been filled, but say plenty more appointments are available for anyone who's been waiting.
And to those people, I think this is the time for them. You know, that it's a lot easier to find appointments now. It doesn't require hours of searching and a lot of work.
In Minnesota, the health department says 42% of people have at least one dose and just over 30% are fully vaccinated. They say the surge of people aggressively looking for shots is done. Now they're running into those who are either hesitant or they've been waiting and may think they still have to work too hard to hunt one down.
To both of those points, I think we can say thank you for allowing others to go first, but it's okay now to take your place in line. And then second, to say that you don't have to be up in the middle of the night or be a computer whiz to get an appointment at this point.
Another problem providers are now running into are health department guidelines that 90% of their shipments should be used within 3 days. They say they'll likely loosen that up next week to give providers and people even more options.
But the 3-day goal has been a significant barrier to being able to be flexible. What it means is that if we receive a vaccine shipment on Tuesday afternoon, we really could not realistically plan a Saturday clinic.
But if those guidelines loosen, Mayo Clinic and Allina Health say it would give them a lot more options in order to have more availability, more clinics. They say they've been very good about getting 100% of shipments used within 7 days. Now, the doctor from the Mayo Clinic says when she runs into patients who are hesitant about the vaccine, about side effects, about efficacy, she listens to their concerns and then gives them fact-based evidence about why it's safe and important. Live in Bloomington, Rob Olson, Fox 9.
All right, Rob, and we do have a special spot on our website for all the latest COVID news, both locally and nationally. Just go to fox9.com and click on COVID-19. It's at the top of the page.
And